I'm going to start with something very obvious. Policy making isn't easy. And it's not made any easier for a number of different reasons. What I want to draw attention to, in at least some of the time I talk today, is the role of narratives and stories in impacting upon what we do as individuals, and especially what we do as policymakers. It was very interesting listening to John talk just now. He said at the start, didn't he, about how only about 40% of people know that 1 in 10 is the same as 10%. It's because we're not really that interested in numbers and data and evidence. We listen to stories. John was much more compelling, if he won't mind me saying, when he started talking about people, when he said about the 80-year-old. These things stay in your mind. And we live our lives in these kinds of narratives and these sorts of stories. I do a lot of work in happiness and well-being, and one of the things that we want as individuals is to have a coherent story of ourselves. So it's unsurprising that that plays through into public policy. And so we're not really going to change policy or change what we do by appealing to more and better evidence and more and better data. Because actually, in fact, we're overwhelmed. We have so much information coming at us, so much evidence and so much data that we literally don't know what to do with it. It's almost impossible for us to filter facts from fake news, for example. So the coherence of stories become even more compelling. The importance of those narratives become even more important. And oftentimes, they'll lead to better policy because they do offer simplicity, structure, and organization. But a lot of times, those narratives get in the way of effective policy making. And I'm going to focus on one particular story. I'm very chastened, is that the word? Or focused on the fact that I can see the countdown clock in front of me, so I need to be very careful of time. So one very important narrative that we have as individuals, and that especially plays through into public policy, is a narrative to preserve life, or to prolong life. Always, everywhere, and at all costs. It feels very virtuous to say that. It gives you a sort of moral high ground almost, to say how much you value life. And I mean, I'm going to say, obviously, you'd expect me to talk about COVID at some point, because that was the magnification of this story. But we see this story played out in the sorts of conversations we have with our family members, who we may not want to have conversations about when they get old, about the way in which they want to die, the manner in which they want to die. It's very interesting, isn't it, that people talk about the only two certainties of life are death and taxes. Some people and companies avoid paying tax, so the only certainty is death. And we don't have very many grown-up conversations about it. The only real conversation about it is the when and how, not the if. Right? And yet, it seems in many ways we feel compelled to try to avoid that and to make it an if rather than a when and how. You see Silicon Valley investing huge amounts of money in trying to extend life to 150 or however many years they want to live for. We see 25% of our healthcare costs go in the last year of our lives. Now, I don't know whether that's an efficient use of money. It probably isn't. As we medicalize death, as everybody needs to be fighting death. Notice how when someone gets a cancer diagnosis, it's always about how brave they were, how much they fought it. And yet lots of good evidence shows that acceptance is a real key part of our own well-being and that of our citizens. And I think the behavioral antecedent of this desire to save life at all costs comes from terror management theory. That's really basically we're scared of dying. And so we do all sorts of things to address our existential dread. We think about the afterlife, or we have legacy projects, all of which ways in which we try to live on after we're dead. And lots of our behavior is influenced by that. Lots of legacy projects, lots of people will think in ways of leaving an impact after they're gone. And we saw this magnified, obviously, during the pandemic, where policymakers did literally say, preserve life at all costs. Now, you don't need to be trained in economics to know that that's not a very efficient or fair thing to do. Because if you're preserving life at all costs, there are opportunity costs elsewhere. But it's such a compelling and powerful narrative that we got sucked into the idea that every death was a tragedy. We actually said that in the UK, every death is a tragedy. Well, arguably the death of very old and frail and ill people is sad, but not necessarily tragic. Because it will happen, we will die. It's only an issue of when and how. The death of a child is both sad and tragic. One, because they've got lots of years ahead of them that they won't yet have, and also because they haven't had that many thus far. So, our response to COVID, and in times of uncertainty, because what COVID represented was essentially a world of radical uncertainty. We heard the word unprecedented mentioned an unprecedented number of times during 2 or 3 years. I wonder whether that word has kind of lost its meaning. I think it's meant to mean something that's rare, but we say it all the time now. And there was certainly a whole range of biases that led us essentially around the world to do largely the same thing, following what everyone else was doing, because how could you not, because that powerful narrative is so powerful. We were driven by fear. In the UK, anxiety levels were at their highest when Europe had gone into lockdown and we hadn't. So there was a public demand for some of those interventions. And also out of situational blindness. This is basically tunnel vision. And this is probably policymakers' biggest obstacle and hurdle. What's important is what's in front of you, not all of the consequent downstream effects of those individual choices that you're making. The focus on trying to save lives means that there will necessarily be misery elsewhere, mostly to younger people, that isn't captured in any of those kinds of decisions. So what I want to do in the last few minutes that remain, last half of what I do, I have one slide. I never use slides. My students at LSE, some of them don't like that, but anyway, I like to engage them. Anyway, so what do we do about this? We could talk all day long about obstacles and hurdles to making effective policy. Together with a PhD student at LSE, Amanda Henwood, we largely motivated out of these kinds of narratives that are really influential, that drive policy, have written a paper where we've come up with a checklist, essentially, of 5 steps, a 5-step framework to avoid biases, A, B, C, D, E, of avoiding biases. The first of which is A, acceptance. I alluded to this earlier. All the behavior change literature for many controversies and uncertainties, there's a remarkable consensus that the first step to changing anything is acceptance. Actually, sometimes feels a bit perverse, doesn't it? Because if you want to really change yourself in some way, you feel like you might want to keep beating yourself up in order to change, because that gives you motivation. Actually, that's completely untrue. Is that what you need to do is sort of take a breath and accept yourself as the flawed, fallible individual that you are, and then that makes change much more likely. In the case of narratives, it's accept that we are all influenced by social narratives. We can't not be. We're social animals. We're driven by the cues that others send us. So if the narrative, for example, is to get rich, right, which actually serves us very well when we're poor, both as individuals and as nations, it's very hard not to get sucked into that story about getting rich. If you take a job that pays you less money than your previous one, people look at you like you're a bit mad, and you feel like you have to justify why it is that you took a lower paying job. Which may be sensible reasons, like it's a nicer place to work, it's nearer home, you can spend more time with family and friends, you like your colleagues, it's a really purposeful job, all the things that actually really matter. But if you take a higher paying job, no one asks why, because it's obvious, right? So accept that it's really hard for any one of us to swim against the tide of expectations. During COVID, it was very hard for any of us to present a case about how we might be doing more to better balance the costs and benefits of our actions, almost apologizing for it, because that powerful narrative to save lives was so strong. So that's the first thing, acceptance. Accept ourselves, accept that we are all driven by these kinds of stories that sometimes get in the way of making effective decisions, both as individuals and as policymakers. Second is balancing. If we are influenced by powerful narratives, then at least think of some competing narratives to sit alongside it. The preserve life narrative is so powerful that saying something like proportionately balancing costs and benefits sounds a little bit weak in comparison, doesn't it? Perhaps minimizing misery. Maybe that might be a little more powerful to push against it. So think about competing stories that could drive our decisions. The third point is see checklists. I know many of you will be familiar with the role of checklists. Started out in the aviation industry, airlines, when many more planes crashed than would otherwise have been the case. And some of those planes crashed for very kind of silly or obvious reasons, like the pilot took off without a co-pilot. And this draws attention directly to situational blindness, because what the pilots would be doing is checking the engines are running, checking all the instruments working, the lights that are on, the ones that should be off are off, and then they take off, and then there's no co-pilot sitting next to them. Because the tunnel vision draws their attention to a limited set of attributes that are fundamentally important to making an effective decision. What a checklist does is it draws our attention away from situational blindness, from the tunnel vision, to consider all of the factors that are substantively important. So now airline pilots have a checklist that includes, do you have a co-pilot? Hospital checklists have, again, really obvious things like, are we operating on this patient? Tick. And literally go through very, very simple, but often ignored, obvious but overlooked attributes that are fundamental to making an important decision. I can't stress enough how important checklists are in a world of situational blindness, where you can only ever really pay attention to what's in front of your nose, unless you're reminded that you need to pay attention to a more complete set of attributes. D is for diversity. If I return very quickly to COVID, if you think about the policymakers and their advisors during the pandemic, well, first of all, professionally, the advisors came from a very narrow subset of disciplines. Epidemiology, modeling, maybe public health, although that was probably stretching it a bit. No one in the room even voicing concerns about impact on education sector, on young people's mental health. It's not always possible to account for everything in a decision, but it is possible to have voices in the room that would articulate. When we closed schools in the UK, I don't think there was a single person there who would have had experience of, or knowledge of, or understanding of the lives of the poorer children who would now be staying at home. So when I say diversity, and actually if you think about the age group of people making decisions and advising on them, they were probably pretty much around my age, right? Sort of people in their 50s mostly. Now, one of the most robust findings we have from happiness literature is a U-shape with age. That, basically you're happy when you're young and you're old, and you're least happy in mid-age. It's one of the things that makes me very happy when I teach my students this, because they're on the downward bit of the U-bend, and I'm now on the upward trajectory. So I can look forward to getting happier over the next few years while they get less happy. But this is a robust finding across many nations, across time. And I suspect it has a lot to do with existential dread. that when you're young, you don't think about dying because you're going to live forever. When you're older, you know you're not going to live forever. When you're middle-aged, you start to get reminded of your mortality, and it's not nice. And it's not nice. So actually, if you think about the policymakers and their advisors during the pandemic, they were all in that sweet spot of existential dread. They were all people who were most afraid of dying. Had anyone bothered to ask younger, and especially older people, actually what they would have liked to have seen done, then maybe we might have got a different set of policies. So diversity by characteristics, including age, gender and race and all of the other things that we often talk about. But diversity of thought, that's the really fundamental characteristic. Lots of evidence to show that you get more effective decision in particular contexts, not in every single context, but when you have a more diverse range of voices, where those voices are being heard, not just tick boxes to say that they're in the room, but actually properly listened to. And then finally, evaluation. In simple terms, this is really trying to capture all of the costs and benefits when you drop a pebble of intervention into the pond. Most often what we do is we drop that pebble of policy into the pond and we look at its splash. But there are always significant downstream ripple effects, some of which can turn into tidal waves. We have no incentives really in the system to properly account for them, because policy making works in silos. You'll all know that. So you're only interested in the pebble and the splash. You're not interested in properly capturing all of the ripple effects downstream. And that requires us to properly capture them, to have incentives in our policy making that allow us to capture them and properly account for them, essentially using some kind of cost-benefit framework. As I say, that's not always possible in times of uncertainty, in times where you have to respond quickly. But being agile requires us to address all of those other points before we get to the E, right? So we have diversity, we have lots of different voices being heard, we accept that we're going to come with our predispositions to have a particular narrative in mind. We learn how to balance them when we use checklists and so on. So that's pretty much, with 40 seconds remaining, everything that I think I wanted to say to you today. Thank you very much for your time, and I hope to speak to some of you during the course of the next 2 days. Thank you.